everyone, and welcome to our streamed live. We are here today with Lindsay Wilson again. She is the IPV Assistance Program Coordinator. And as you recall, she's been doing a series this whole month during October being Domestic Violence Awareness Month. And today is our very last stream in the series. So, Lindsay, welcome again. And what are we going to talk about today in terms of IPV and domestic violence awareness?
Well, thank you, Rosalia. I thought that we could finish the series by talking about some kind of lesser known forms of intimate partner violence, looking at like intimate partner violence against men within the LGBTQ plus community, and also talking a little bit about bidirectional violence.
That's a really great idea, because when people hear the words domestic violence or intimate partner violence, they really never think of men being victims of this. Mm-hmm. So let's talk about how it impacts men in very different ways than it does women.
Absolutely. It can, well, first, I think exactly what you said. I think that when we picture domestic violence, we picture like a man hitting a woman. And while that does happen, that's not the extent of everything that happens. We know that men experience intimate partner violence as well, based on data. And that goes for male veterans too. And sometimes I think that we have this idea that like men are not supposed to be like victims, right? Sort of being kind of big and strong, and especially veterans. But there's data. There was a study done of veterans who served since 9/11, just a few years ago, and almost 40% of the men in that study reported that they experienced intimate partner violence recently.
And so what does it look like for men? How does interpartner violence unfold for men? Is it different from the way it looks like when women are the victims?
So it can look, a lot of the forms of violence are the same. Physical violence, right? Pushing, shoving, maybe, and maybe if the man is bigger than the woman, maybe it's not having the same kind of impact, but certainly all of those things can still happen. I've worked with a lot of veterans, male veterans who have had wives or partners that have hit them. A lot of the verbal and psychological abuse, insulting, demeaning, belittling, screaming, cursing, yelling. And I think sometimes the gender can play a role in that, right? Like you're not a real man. Sometimes that can be part of the verbal and emotional abuse that someone feels. Like, this is not abuse. You're a man, I'm a woman. So sometimes that can even like be part of it, right? It can be sort of like a way that people gaslight someone, for example, to say this is not abuse because you're a man and I'm a woman.
In my previous work as a journalist covering domestic violence, one of the things that came up all the time when men were victims was that men are not very open or keen about seeking help because of a lot of reasons. Can you talk about that?
Absolutely. I think sometimes there's a lot of stigma against men experiencing violence. I think sometimes men might not recognize it as abuse if they're not like hurt, right? Even if someone hits you and it doesn't really hurt, then maybe it's like, okay, well, that's not really a big deal. I'll just deal with it. And you don't have to. I think sometimes people think that other people won't believe them. And unfortunately, sometimes that's the case. Sometimes like law enforcement or the courts or other kind of helping areas are more oriented towards the idea that a woman is a victim. And they just don't really want to believe that a man is being abused, or they're like, you're fine. Like, you're a guy, you can deal with it, kind of thing. And sometimes maybe there are places that can help that are accepting, but men maybe just don't know about them. And I think it does take a lot of strength and vulnerability to be able to say that this is happening, because there are so many stereotypes about like masculinity and like I said, men being kind of strong and bigger and not being victims, that just to even admit that can be really hard.
Would false allegations of rape fall into that category as a form of control? Like, if you don't do X, I'm going to say that you did Y, or, and does it also impact a man's ability to interact or have visitation or be with their children? Does it impact that family dynamic?
Sure, I think there can be a lot of legal consequences. I think sometimes if there's a female partner who's being violent, they can threaten to call the police, and with the expectation that they'll be believed by the police, and the male partner won't, with various kinds of whatever violence has occurred, and sometimes that happens, right? I think it's probably. I wouldn't be surprised, right, if maybe a female partner is abusing a male partner, and they call the police, and either both or the male partner end up being arrested. And certainly, like, I think children in custody are always a concern when it comes to intimate partner violence and leaving relationships. And so I think that's definitely can be part of it. I don't have data specifically on what it looks like gender-wise, but I think I know talking to veterans, that's always a concern.
Mm-hmm. And so let's talk about domestic violence within LGBTQ partners.
Yeah.
Like, you don't really expect that to happen, but in my reportage in previous worlds, I saw that it did happen. So can you talk a little bit about how that unfolds and what it looks like?
Yeah. And I will say, actually, in the LGBTQ plus community, people can be at higher risk of intimate partner violence. And I will say generally, I think whenever someone has kind of an existing vulnerability, or they're a member of a marginalized community, that can always be kind of a tool for abuse. And, intimate partner violence can look the same. Like I said, verbal abuse, physical abuse, emotional abuse, financial abuse, those can all exist, but they can look a little bit different in the LGBTQ community. So, for example, a partner might threaten to out their partner, and that can be very dangerous. They might deny access to care. So if they have a trans partner, maybe denying them access to hormones or surgeries. We know that sometimes, particularly within like gay men, sometimes HIV is of concern, and that can be another thing, threatening to out someone's HIV status or accusing someone of being dirty if they want to use contraception. So that can be a sort of like sexual abuse form. Sometimes even just like initiating public displays of affection at a place that it's not safe, that will put your partner at risk. That can be a form of abuse. Using slurs, controlling how your partner expresses their identity, whether it's sexuality or gender, using stigma to harm them, either anti-LGBTQ, anti-HIV stigma, etc., preventing them from receiving care. And I think similarly to, like I said before, there can be this like gaslighting of like, well, this is not abuse. Like, we can't abuse each other. Like, we're two women, we're two men. This can't be abuse. And that can be a different form of it that doesn't necessarily happen in heterosexual couples.
So how does, because there's maybe perhaps a lot more fear about being outed, or whether about gender or about orientation or about HIV status, we know that all of the domestic violence in IPV is a matter of power and control. So how would, in an LGBTQ couple, how would it happen where one would deny another access to medical care, or to be not telling, like, how does that happen?
Sure. I think it can be sort of a spectrum of what that looks like. And also that can be something that like happens maybe later on, once there is a really strongly established pattern of control. Sometimes it's like, well, I have the car and I'm not taking you. So and I control the money. So like, you know, you have to figure out how to get yourself there. Sometimes people call and cancel appointments, and it is easier if you have a same-sex partner for someone to pretend to be you. Sometimes they say, if you go, then I will XYZ, whatever kind of threat. So there's lots of different ways. And sometimes, again, like if this has been going on for a while and there's a really strong pattern of power and control, there can be a lot of fear with doing something your partner doesn't want you to do. So it can even just be that, right? Like telling someone not to do it. That can be very fear inducing. But yeah, I think a lot of people do control like direct access to healthcare, whether it's money, transportation, medication, right? If you have medication in your home and you have a partner who's abusive, they can throw it away, they can hide it, they can, do something with it. So
all that sounds very frightening.
yeah.
Which brings us up to something that you mentioned in the beginning, bi-directional violence. Can you explain exactly what that is? And does it cut across all socioeconomic levels and all forms of couples, whether they're hetero or whether they're LGBTQ plus?
Yes, absolutely. So bidirectional violence just means that both partners are using and experiencing violence, either, maybe at the same time or in general. And I think it's more common than people think. I think when we imagine domestic violence and intimate partner violence, we have a particular image in mind. And it's a form of violence that we call intimate terrorism. So within intimate terrorism, there is like one partner who is in control, violent. There is a very clear pattern of coercion and control, with a combination of like various tactics, physical, sexual abuse, other tactics of coercion, right? And that happens. That is very much a form of intimate partner violence, but it's not what everyone experiences. There's also kind of on the other end of the spectrum, what we would call situational violence or situational couple violence. And this is really like it like the name says, right? A situation comes up. There's a conflict in both people that escalates, and perhaps both people are engaging in violence in this situation. So that is, I think, more common than people think. And in those cases, there can be a lot of bidirectional violence. And that can happen that can happen in same-sex couples. It can happen in heterosexual relationships and other forms of relationships.
So would that be something as simple as partner A hits partner B and partner B hits them back? Or each of them using violence to try to control the other? I mean, if there's a dynamic of power and control going on in partners where there's bi-directional violence, then how does that power and control play out?
Sure. So I think that there is not always that pattern of power and control that we think of as characteristic. I think that belongs in the intimate terrorism. And I think there is also a dynamic of like potentially self-defense within that type of relationship. I think in bidirectional, when we're talking about bidirectional violence and situational couple violence, we don't necessarily have that overall dynamic with that pattern of coercion and control. It is maybe truly more of a situation of like both members of the couple are not communicating effectively, not really able to handle conflict, not handling it well when things escalate. And so they are both kind of clashing in that way. And I think that's part of the thing, when we have a couples group, our Strength at Home couples group, and that's something that we do intakes to sort of get a sense of this dynamic. Because certainly if we get a sense that there is one partner that's really, because, you can have a situation where it's like, oh, well, partner A shoved partner B shoved them back, right? And that can mean very different things.
Yeah, I mean, to me, that would seem like self-defense. If you're going to hit me, you're not going to get away with it. I'll hit you back. Or if you shove me, I will shove you back. It's sort of like a reactive thing. So how does that differ from the domestic terrorism or the interpart? Like that terrorism is kind of a scary word. So can you explain that a little more?
Right. So with intimate terrorism, I would picture it as kind of the stereotypical situation that we think of. There is one partner who is in control. I think stereotypically it is a male partner. That doesn't always have to be the case. There is one partner that is in control. They are controlling, they are violent, they are angry, they are making the decisions, they are controlling the finances, they are telling you what you can and can't do. And if you maybe you step out of line and then they harm you, and maybe the person experiencing violence in that situation might try to push them back. That I would not consider that like bidirectional violence. Bidirectional violence, both people are arguing, right? Are picking at each other, provoking each other verbally, and maybe things escalate from there. So it's a dynamic that both people are participating in on a more equal footing, I guess I would say is the difference there. But that's something that we do. There is nuance to it. And it's an area that I think there's more research being done. There are people within the VA that are doing research. They were actually piloting screening tools to see, because we ask people when we screen, are you experiencing violence? But they're working on piloting tools to say, are you experiencing violence? And also, are you using violence? But I definitely think that there has to be nuance to it, right? Because like you said, there is a difference between like bidirectional violence and like trying to just defend yourself. And so that's something that we take into account. Like when we're talking to people, when people are referred to us for strength at home couples, we do an intake with everyone to get a sense, because if it is an intimate terrorism situation, they're not really appropriate for couples work, because we don't ever want to make it seem like it's, oh, you have something to work on and you have something to work on, when it's clearly like one partner that's kind of in control of the dynamic. Whereas if both people are kind of more actively participating in it, then that's something that maybe both people can stand to benefit from some additional conflict management and communication techniques.
So how does VA help men, and how does VA help men who are experiencing violence, LGBTQ couples who are experiencing violence? How does the VA approach these couples and this kind of IPV?
Sure. And I will say generally, we approach them like we would anybody else. Our services are open to everyone. I get a fair amount of referrals for male veterans, or for veterans who are members of the LGBTQ plus community. I work directly with our LGBTQ veteran care coordinator and her committee to make sure that we're able to be like inclusive and that we're connected to folks who are seeing that our veterans in the LGBTQ community, so they know that we exist, and try to have materials that are particular to, that do speak to some of these particular kinds of violence that men may experience, or that people in the LGBTQ plus community may experience, just because I think sometimes everybody has the same stereotype, right, in our heads, even if we don't fit into it. We all kind of have that stereotype. So sometimes we don't even recognize in ourselves that this is what we're going through without some of these experiences being directly reflected at us. So that's something that we try to do. We actually just had a training for staff about IPV in the LGBTQ plus community earlier this month to help other staff recognize what this can look like, so that they can make sure to connect people to the resources that they need.
Is it more subtle? Are the signs more subtle in the LGBTQ community? The signs of, domestic violence taking place, especially if, are the signs more subtle? I guess is the question.
I don't think the signs are necessarily more subtle. I think that generally, societally, maybe we're not looking for them. And I also think that there are barriers, in the same way that I talked about like men. There is a lot of stigma still. Like, it's 2024, but there is still stigma. I think especially, within like the VA and like military communities, for people to be kind of open about their sexual and gender identities. So I think that the signs themselves are not necessarily more subtle. However, people may be more reluctant to speak up. And I think maybe as providers across the board, maybe we are not as attuned to look for it. So that's part of the reason why we did the training for providers, to be like, hey, kind of put your antennas up, be aware that this can happen. Because like I said, I think sometimes there's this idea, it happens in law enforcement, it happens in courts, that like, if two women are in a relationship and there's violence, it's like a fair fight. For two men, it's a fair fight. And that's not necessarily the case, right? There could still be this dynamic of power and control and harm that we want to be able to intervene with. So I think the signs themselves are not necessarily subtle, but just maybe the presentation. It's just people might not be as open with it, and we might not be looking for it.
So does the program actually work with pharmacy? Because in before, when you said that in couples that, where there's denied access to medical care or medicine's been thrown away, does VA help that veteran whose medicine has been thrown away for whatever reason have access to a new prescription? Is it like, how is confidentiality kept? Is it noted in the file? Like, how does that happen?
I think all the specifics are sort of like case by case basis, but definitely we've worked with pharmacy, and also sometimes people have to like flee and leave things. So we've definitely worked with pharmacy before, worked with providers to get new prescriptions for people. We've worked with privacy and medical records to get things, make sure things are private. We're not using them as much anymore, but like before, when we had the kiosks, there were people that were concerned that a partner would look up their information in the kiosk and know when they were coming for appointments. So we worked with kind of many levels of the organization to figure out how to remove that, to remove them from the kiosk so that couldn't happen. So there are definitely sometimes, situations come up that we haven't dealt with before and we have to get creative, but definitely we work with kind of anyone throughout the system and in the community to help make sure that the veteran has what they need to be safe and maintain their care.
So in short, if veterans are experiencing domestic violence, whether as a user or as a receiver or both, and if they're a hetero couple or LGBTQ plus, none of that matters. What matters is if you're a veteran, VA can help you and VA will serve you.
Absolutely. 100%. That covers it. Perfect. It's just, we're here, and we'll, like I've said before, we'll meet you where you are and try to help however we can, whether it's like, maybe you just need some resources, maybe you need to talk to us about safety planning, maybe you need RISE if you're experiencing violence for some additional counseling, maybe if you're using violence, you need strength at home to work on some of those skills and how to manage that better. And if you're a couple that's maybe struggling with conflict, we have strength at home couples just to help improve that communication and managing conflict. So we have a lot of different services. We connect with different resources in the community and within the VA. So whoever you are and whatever the specifics of the situation are, we are here to try to help.
So is there anything that I did not ask you that you think it's important for veterans to know, especially veterans who are struggling with domestic violence or witnessing their friends struggling with domestic violence? Like, how can people who are witnesses help their friends in those situations?
Sure. I think as people witnessing intimate partner violence, it can be really, really hard. First of all, especially I think, we don't want our friends to be in that situation. We just want them to leave. And unfortunately, sometimes it's a lot more complicated than that, either logistically, financially, kids, or just emotionally. It can be really hard. So I think one of the really important things is just to kind of keep an open line of communication with your friend, because isolation is a tool that violent partners can use, right? And if your friend feels like they don't have anyone to turn to, then staying in that relationship might just feel like the only place they have to go. So trying to be non-judgmental, right? I'm here if you need me. And even just putting it out there, right? There are programs to help you if you need it, if you want to call someone. I'll call with you. You know, I did an information table at the medical center, and lots of people would take materials to give to other people because they wanted to just, they know something's going on and they're concerned and they want to just kind of, you know, leave a little card, leave a little phone number. And sometimes things like that can be really powerful, just for someone to know that like they're being kind of seen and heard, and that someone is concerned about them. Because sometimes you know, abusive partners can tell them explicitly that nobody else cares about you, right? And it's important to be a counterexample to that. And even though it is really hard, especially if it's like obviously you should just leave, and watching someone not, that can be a real struggle. But it really is so powerful just for them to know that they have someone in their corner. And maybe you can let them stay with you. Maybe that's more than you can handle. But just, you know, being able to be an ear, and knowing that you're concerned and that you're, you know, kind of keeping an eye, can be really powerful.
Well, thank you, Lindsay, for a very illuminating series on IPV and domestic violence. I think we've definitely raised awareness about what it is and how VA serves veterans who may be experiencing or using violence, and how we're here to help. So
Yeah.
thank you all. Veterans, you got the skinny and the tea from us today. This is the final one. If you have any questions, you can post them in the comment section below. Don't forget to like and follow, and we will see you again. Thank you all. Bye-bye.